A stroke, our medical term for it is a cerebrovascular accident, or a CVA. Cerebro meaning having to do with the brain, vascular meaning having to do with the blood vessels. So there's a problem with the blood vessels inside the brain that interrupts blood flow to some part of the brain and results in the loss of brain function. So the brain is not working as it's supposed to. You really need to know the difference between ischemic strokes and hemorrhagic strokes. An ischemic stroke is caused by a thrombosis or an embolus that's blocking blood flow. There's some kind of blockage. This is more than 80% of the strokes, so it's really common. The symptoms can be anything from nothing at all to complete paralysis. It just depends on what part of the brain's affected. And usually the cause is atherosclerosis in the blood vessels, which is that fat and calcium buildup in the blood vessels. Okay, this is what the ischemic stroke looks like. You have a blood clot. A lot of times it comes from the heart. It gets thrown from the heart, but it can come from anywhere in the body, down in the legs, anywhere, travel up to the brain. When it gets to the brain and it causes a blockage, everything beyond that clot is not getting the blood flow it needs. So for this person, whatever this part of their brain controls, that's what they're going to have problems with. So as you can see, everything that's downstream of that clot, it's not going to function as it's supposed to. Hemorrhagic stroke is different. It's when the blood vessel ruptures open. This is only 13% of strokes. These are more often fatal. The risk factors for this, instead of a blood clot, now we have something rupturing open. So the risk factors for a hemorrhagic stroke are usually hypertension, especially those hypertensive emergencies where the systolic gets above 180. That pressure just rips a hole into an artery in the brain. And this causes a lot of problems because that blood is leaking out, so everything downstream is not getting the blood it's supposed to. But also, this blood you can see on the scan here is going to start to push on the other healthy parts of the brain. So it can shut down a lot of the brain function. Hemorrhagic strokes can also happen in healthy young people. When that happens, we call it a baryaneurysm. It's just an aneurysm. It's just a weakness in the blood vessel in the brain. It's just something that is congenital, just happens, and it ruptures open. Usually they'll tell you they have the worst headache of their life. It's an extremely bad headache, and it's just bleeding under the arachnoid, under the, bleeding in the actual tissues of the brain. Okay, a TIA, or a transient ischemic attack, people usually call this a mini stroke. It sounds kind of weird, but this is one of the luckiest things that can ever happen to a person. Because look at what a TIA is. They have stroke-like symptoms that go away on their own in less than 24 hours. So there's no permanent damage done, and it's a warning sign. Usually if you have a TIA, either a blood clot got stuck and then it broke free. Okay, now we know I have a blood clot in my brain somewhere causing a problem. I need to get that taken care of. Or I had a blood vessel, maybe it was hemorrhagic, I had a blood vessel rupture open and leak out a little bit of blood, and then it fixed itself. It clotted over, and now blood's flowing again. Okay, I got a problem in my brain that needs to be fixed. So it's a warning sign so that people can get to the hospital and get treated. That being said, when you work on an ambulance, it's a little bit of a difficult situation. You'll notice with the symptoms of strokes, none of it really involves pain. Yeah, they might have a headache if it's a hemorrhagic stroke, but over 80% are ischemic strokes. There's no pain involved. They lose control of part of their body or something, but that's it. So you show up, they have no symptoms because their symptoms went away. They had no pain, and they might not even have recognized that they had those symptoms. We'll talk about that a little bit more, but sometimes you don't recognize that yourself that you have the symptoms. So it can be really difficult to convince the patient that they need to go to the hospital. And our job is to make sure that they understand that at least 1/3 of the patients who have a mini stroke will have a real stroke soon after, and those effects will be permanent. So it's a good warning sign, and they need to go see a doctor. What are the signs and symptoms of a stroke? Again, it depends on what part of the body it's in. I'm not going to ask you to be a neurologist and know exactly what part of the body, what part of the brain controls what part of the body and all that. Just know that throughout these next few slides, we're going to look at a bunch of symptoms. If you see any of those symptoms, you should be thinking, oh, this looks like a stroke. Facial droop, sudden weakness or numbness in the face, arm, leg, or even one whole side of the body, but especially one side of the body is a big clue. Decrease or absent movement or sensation, again, on one side of the body. Lack of muscle coordination, maybe they're just losing their balance. Vision loss, blurred vision, double vision, any kind of problems with vision. That's a problem in the brain, could be a sign of stroke. Difficulty swallowing, use muscles to swallow. So if they're drooling, that's a sign of stroke. Decreased level of responsiveness. Maybe they're unresponsive completely. Maybe they're confused or they don't know where they're at. Speech, obviously, that's all controlled by the brain. Speech disorders, again, things controlled by the brain. Difficulty expressing thoughts or inability to use the right words. They might look at you and say, yellow, purple, Tuesday, tomorrow. And they're trying to say, I need to bring my purse. But the communication center of the brain is not working. Dysarthria is slurred speech. That's a common sign of stroke. Dys means difficulty. Arthria, if you think about it, arthria sounds like articulate. Art is articulate. So dysarthria is difficulty articulating speech. So it's slurred speech. Sudden and severe headache, especially a sign of hemorrhagic stroke. Confusion, dizzy, weak, combative, restless. Again, all these things controlled by the brain. Tongue deviation, that means if you stick your tongue out, instead of going straight out, it goes to the side. So if you ask them, hey, stick your tongue straight out at me, and they go, but they think it's straight out, that's tongue deviation. That means the muscles of their face are not working appropriately. They could be in a coma because they've lost responsiveness. Okay, the left side of the brain controls speech. So they may have aphasia. A means without, phasia means speaking. So they're not able to speak. They may be able to say words, but they can't produce speech or they can't understand speech. They can't communicate. It's the communication center of the brain. The left side of the brain controls the right side of the body. So the right side of the body might also be affected. The right hemisphere, so the right side of the brain controls the left side of the body. So we may see paralysis of the left side of the body if the right side of the brain is affected. They can understand language and they can speak because the speech centers in the left side of the brain, but they may have slurred speech because the left side of their face is not working. The muscles aren't working. They may be oblivious to their problem. This is what I was talking about earlier. We call this neglect. They can't see or hear that their speech is slurred. They can't realize that their arm's not working or their leg's not working. Their body, their brain blocks out the fact that that's not working. It's a really weird thing that happens, but it makes strokes really bad because people don't get help because they don't know anything's wrong. If they live by themselves, there's no way to know they're having a stroke because they don't recognize that anything's wrong. If it's in the back of the cerebrum, it can cause problems with vision. Like I said, neglect, they can't see that there's a problem. There's no pain involved. Why would they get help? So people can really wait a long time to get help. It's until, a family member or a visitor or somebody sees them and realizes there's a problem that they actually get help. High blood pressure can be kind of confusing with brain bleeds. So if you have really high blood pressure, hypertensive emergency, and it ruptures open a blood vessel in your brain, it causes bleeding in the brain. On the flip side, you might have noticed one of the symptoms of a stroke is high blood pressure. So when there's swelling or bleeding in the brain, it increases your body automatically increases your blood pressure. And you don't need to know why, but if you want to know why, it's because if you think about it, your brain needs oxygen. It needs oxygenated blood. So if there's a swelling or a bleed in your brain and it's starting to compress on everything, we have to pump with harder pressure to force that blood up our carotid arteries and into our brain. So if you have bleeding in the brain, your body's going to raise your blood pressure to force the blood up into the brain. Again, to recap, if you have high blood pressure, it may cause bleeding in your brain because it can rupture open those vessels. So it's which came first, the chicken or the egg? We don't know. Did they have high blood pressure that caused their brain to bleed, or did their brain bleed cause their blood pressure to go up? There's no way of telling in the field. So if the blood pressure continues to increase, that is a good sign that probably the bleeding caused the rise in blood pressure and it's continuing to bleed and it's continuing to raise the blood pressure. Now, when we go into neurogenic shock, what's the worst symptom of shock is lowering blood pressure. So if their blood pressure starts to drop, that's not a good thing. That means they're going into shock and it's getting worse. Okay, other things that may look like a stroke. Hypoglycemia, low blood sugar. We'll learn about in the next couple chapters, but Remember, if the brain doesn't have the right amount of glucose, it's not going to function properly, so it may look like a stroke. Postictal state is what happens after a seizure. Again, may look like a stroke. The brain's deprived of oxygen, not functioning as it's supposed to. Bleeding in the brain. The one on the left here is labeled correctly. This is a subdural hematoma. It's bleeding under the dura. You can also have, this is labeled incorrectly. The one on the right should say epidural hematoma, because you can see it's bleeding on top of the dura. So epi means on top of. So the epidural hematoma means bleeding outside the dura. Both of these are going to push on the brain. It doesn't matter. This extra blood is pushing in on this brain tissue here. This extra blood on the right pushing on the brain tissue. So that's going to look like a stroke. It's going to make that part of the brain not function appropriately. Symptoms are going to be the same. Emergency medical care. If someone's had a stroke, they need to get to the hospital to do a scan to figure out if it's a hemorrhagic stroke or an ischemic stroke. The way they treat them are very different. You need to let the hospital know, when was the last time the patient was known to be normal or without stroke symptoms. This can be really difficult. You really have to ask questions, you know, especially like somebody wakes up in the morning and they have symptoms of the stroke. Well, when was the last time they were seen normal? I don't know. What time did you go to bed? 9 p.m. Okay, did you wake up in the middle of the night, or did they wake up in the middle of the night and go to the bathroom? Did you notice if they were seeming normal, or did they have these problems? Did you talk to them? And it's really important we get that information, because there's a limited time window when they can give the different treatments for stroke. Okay, maintain their ABCs, get them to a hospital rapidly. Hopefully you have a stroke center in your area. Keep their oxygen saturation at least 94%, because that lack of oxygen to the brain is going to make the problem worse. And again, if they have that oxygen saturation of 99%, we're not going to give them oxygen. If you give them too much oxygen, it'll actually reduce blood flow to the brain. So you want to keep them right at 94. Okay. Thrombolytic therapy is what it's called when they go at the hospital, the treatment they give at the hospital. They go in and they remove the blood clots. They can mechanically remove it, or they can give thrombolytic medications that break up the blood clot. So it thins the blood. So if you have an open bleed with a hemorrhagic stroke, it's going to make it worse. So that's why they have to get the scan in and all that. And this thrombolytic therapy has to be given within 3 to 6 hours. So that's why they need to know, when was the last time they were seen normal. Get them to a designated stroke center. Time is extremely important with strokes. That's why you hear the FAST mnemonic. The T stands for timing. You want to get them to the hospital as quickly as possible.